Welcome back, Science Ghostbusters, to Decoding Long COVID, Dexamethasone, and Beyond. I'm Dr. Shikha Agrawal, your guide through the eerie corridors of this condition. After fortifying the immune system's defenses last time, I'm ready to chase the spectral remnants of SARS-CoV-2 that haunt long COVID patients in today's episode on viral persistence and dexamethasone. As someone who has cracked the molecular shadows of Leishmania helicases, I'm intrigued by how dexamethasone deals with viral persistence. Prachi Virat is here, our microbiology sleuth, with a passion for microbiome and bioinformatics, ready to shine a light. Prachi, the idea of viral remnants lingering like ghosts is chilling. How does viral persistence fuel long COVID? And how does dexamethasone tackle it?
You nailed it with ghost metaphor, Dr. Shikha. Viral persistence, where SARS-CoV-2 RNA or antigens linger in tissue like gut or lungs, is a key long COVID driver. A 2024 Nature Medicine detected viral RNA in 25% on long COVID patients' gut biopsies, triggering chronic inflammation via cytokines like IL-6. This keeps the immune system in frenzy, causing fatigue and pain. Dexamethasone calmed this by suppressing cytokine production, reducing inflammation. A 2024 Journal of Clinical Medicine trial found it lowering IL-6 by 30% in patients with detectable viral antigens, easing symptoms in 40% of cases. But here's the catch: its immunosuppression can delay viral clearance, potentially prolonging persistence, as a 2024 viral study noted. It also increases reactivation risk for latent viruses like EB.
That's like banishing one host only to stir up others. With your bioinformatics lens, how does the microbiome interact with viral persistence? And can we use data to optimize dexamethasone's effects?
Love the spooky vibe, Dr. Shikha. The microbiome's like a haunted house foundation. Dysbiosis in long COVID with reduced Faecalibacterium and Bifidobacterium weakens antiviral immunity. A 2024 gut microbe study linked low SAFE levels to higher viral persistence as CFAs boost T cell responses. Dexamethasones worsen this dysbiosis, cutting SCFA producers by 20% per a 2023 mBiome study, which can amplify viral reservoirs. Bioinformatics is our ghost hunter gear. Metagenomic sequencing identify patients with depleted antiviral bacteria who need probiotic to restore balance. A 2024 Nature Communication study used machine learning to predict dexamethasone's efficacy, finding patients with higher clostridium level had a 35% better symptom relief due to enhanced immune priming, helping us tailor dosing to minimizing persistent risk.
All right, Prachi, you have lit up these haunted corridors with brilliance. Let's gather these insights like sealing ghostly portals. You have shown viral persistence as a spectral force driving long COVID's inflammation, with dexamethasone as an exorcist reducing IL-6 by 30%. But its immunosuppression risks stirring new spirits like EBV reactivation. The microbiome's a key ally, and bioinformatics is our spellbook. Prachi, what's your key takeaway?
That ghost metaphor's perfect, Dr. Shikha. Dexamethasone banishes some long COVID spirits, but we must avoid wakening others. The microbiome's our protection ward, and bioinformatics craft the spells for precision treatment. We are ghostbusters in this long COVID mystery, clearing the halls with science.
Thank you, Prachi, for sharing your valuable insights, and thank you, listeners, for sticking with us. If you liked the episode, hit subscribe, share this episode, and join us on social media with our hashtags. Let's keep busting long COVID's ghost. Stay curious.